everyone, welcome back to Happy Healthy Smiles. Thanks so much for joining me. My name is Farah. I'm a registered dental hygienist. And before we get started, don't forget to subscribe and please share the video with as many people, just so helps the channel grow. Thank you. Now today we're talking about pregnancy and oral health. Did you know oral health is extremely important part of a healthy pregnancy, not just for the mother, but also for the baby? And even before you begin becoming pregnant or try to become pregnant, I always advise women to come in for a thorough cleaning and a detailed dental checkup with x-rays. So you want to prevent any emergency when you're pregnant. Also, you want to address if you have any gingivitis before pregnancy, so it's not untreated and progresses and becomes worse during pregnancy. If you have any cavities, we can find them on the x-rays and treat them beforehand to avoid any dental issues or any medications during pregnancy. Now, the first 10 weeks are extremely important. It's when the formation of organs occur in the fetus, and it's called organogenesis. 4 to 5 weeks is when the tooth buds develop for the baby teeth, and at 16 weeks, the permanent adult teeth develop. 9 to 12 weeks is when initial mineralization occurs. 4 to 7 weeks of the fetus life is when the lips form, and at 6 to 9 weeks is when the palate forms. The cleft lip is apparent at 8 weeks, can be seen on the ultrasound, and cleft palate is seen or apparent at 12 weeks, but you probably need a 3D ultrasound. It's much more difficult because it's in the back of the mouth. Now, cleft lip, if you remember, is when the lip doesn't close all the way, so there's a space, and cleft palate is the same. When the roof of the mouth, it does not close all the way, so it is an opening. One medication or antibiotic you want to avoid during pregnancy is tetracycline. That is really not recommended because it causes permanent discoloration on teeth later on. And another thing you want to avoid is if you're wanting to whiten your teeth, you want to do it before you're pregnant. Really not advised during pregnancy or while you're breastfeeding. So if you have an event coming up and you wanted whiter teeth or for whatever reason, do it before you're pregnant and definitely before breastfeeding either. Now, there's a few oral conditions that are very common when you're pregnant, and one of them is called pregnancy gingivitis. Now, this one is very common. It's about 40% of all pregnant women have some form of this, and it's an increased inflammatory response to bacterial plaque during pregnancy, and also it is very common on the front teeth more than the back teeth. And these signs are intensified by poor oral hygiene, poor diet, and also if you're a mouth breather. The signs will be you'll have puffy gums, red, bleeding when you floss, a lot of bleeding when you come in for a cleaning. So make sure your oral hygiene is really, really good. And it's not the pregnancy causing the gingivitis. If you usually have gingivitis, the hormones, the estrogen and progesterone, just cause a more inflammatory response. Another very common condition is tooth erosion. That happens when you have a lot of morning sickness, you're vomiting a lot, especially the first trimester, or during the second and third trimester when you have heartburn, acid reflux. So it increases exposure to gastric acid. And you remember erosion is the demineralization of enamel through acid. So if you're throwing up a lot, make sure you're rinsing your mouth out. Wait 1 hour at least before you brush your teeth because that gastric acid has softened the enamel. And if you brush your teeth right after, it will cause a lot of demineralization and erosion of the enamel. And usually happens, the erosion is back of the teeth usually, and back of these teeth. Those are the lingual surfaces. Another common occurrence is a lot of women notice more cavities. Now, it's not the pregnancy causing it, it's just certain things happen, like you're prone to eating more carbohydrates. You might have a sweet tooth during pregnancy, you're snacking more. If you're nauseous, you're maybe chewing or eating a little bit of crackers every 10-15 minutes to prevent nausea. So all these carbohydrates, the longer they stay, create more plaque. Plaque left unattended for a long time can cause demineralization. So that is sometimes why you notice more cavities when you're pregnant. So you want to have a healthy diet, avoid sugary drinks, and be really good with brushing and flossing. Another oral condition is tooth mobility. This is again a response to a lot of inflammation due to progesterone and estrogen. And these two hormones also cause the shifting of the bone and loosening of the ligaments that surround the teeth, and your teeth might feel a bit looser. Very important. Come in if you to the dental office if you feel your teeth feel very mobile. Another less common is called a gingival granuloma, or a pregnancy granuloma, or a pregnancy tumor. It sounds worse than it is. What happens is usually occurs on the front of the teeth, where the gums between the teeth, they become extremely enlarged, very vascularized, and it's about 2 centimeters large, and it reverses after pregnancy. Now, one of the worst oral conditions that can occur is periodontitis. That is when the gingivitis is untreated and it progresses to more severe form, and that's when you can get periodontitis, which is more permanent damage. It's the permanent loss of the alveolar bone, which holds the teeth, and permanent loss of tissues surrounding the teeth. So make sure for all of these conditions you have really impeccable hygiene. Be very meticulous about removing plaque, especially around the gum line, around here, all around where the gums and teeth meet. Very common area, and on the insides. Make sure you're flossing daily. If you have a hard time putting fingers in the mouth with the regular floss, try to use the floss on floss sticks right here. So that might be a bit more easier. Use a tongue scraper, especially if you have a lot of issues with plaque buildup. So this will remove the plaque from your tongue also. Make sure you have a healthy diet, extremely important. And you should be on top of your vitamins and supplements. So talk to your doctor who is taking care of you during pregnancy. And also make sure you drink lots of water. And if you notice a lot of erosion of your teeth, or if you've been vomiting, you have a lot of heartburn, you might want to have a fluoride treatment at the dental office. You might want to increase the fluoride in your toothpaste. Have a toothpaste with a high percentage of fluoride. You might also want to try Pro Enamel to help reduce sensitivity if it's cause erosion. And I also want to address a misconception about teeth becoming softer during pregnancy or after pregnancy. Actually, teeth do not become soft. The minerals from the enamel and dentin, which form the tooth, do not leach out or share any available nutrients with the fetus. But if you are low in calcium and phosphorus, and the fetus will take that from your bones, including the alveolar bone, which holds the teeth into place. So make sure you have enough calcium, you have phosphorus, folic acid, zinc. Those are all really good minerals and vitamins for the baby and for yourself. And also, if you have any issues, please discuss it with your dental professional, your hygienist, dental hygienist, or the dentist, or your doctor. I hope all of these tips have helped, and feel free to leave a comment or anything that's helped you prevent any gum issues during pregnancy. Love to hear from you. Otherwise, take care and see you soon. Bye.